may be beneficial. Just kinda depends on each individual. See, we do individualized care. Um, we don't do cookie cutter templates, and that's why we get such good results. I'm not getting my resting metabolic rate calories on a daily basis. Marcella, that's gonna lead to metabolic downregulation. If you're not eating enough calories, if you're not getting enough protein, calories, micronutrients, your body is going to go into starvation mode. That's just how that works. It's just a matter of time. Week 4 of Manjaro, but I'm constipated even though I'm drinking 2 liters of water. Any tips? You're probably not getting enough electrolytes, would be my first guess. We could take some blood work and we can take a deep dive and figure out what might be going on. Retatrutide alley from 503A, sourcing is gonna be a couple $100 a month. That's pretty standard though for most peptides, most GLP-1s. Semaglutide is much more affordable though. Yeah, I would take electrolytes because when you're fasting, your body needs electrolytes. You need electrolytes 24/7, but when you're fasting, you need them more because you're losing electrolytes. And so I'm a big fan of taking electrolytes and even a little bit of extra salt, during your longer fasting windows. Once again, I can't override any medical advice that you're on. Uh, Potentially the answer is, that it's okay, but I don't know because I don't know exactly, what's going on with your health. But you can work with our providers and, we could actually do that. Take a deep dive and figure out what might be going on. Have you ever seen someone have better results with semaglutide than tirzepatide? Um, yes, but it's rare, but yes, I have. Remember, 25-30% of your results comes from the GLP-1. 25 to 30% of your results comes from the peptides and the medications, and the rest of the results comes from lifestyle interventions. I see a lot of people are just joining us here on the live. Welcome, welcome everybody. So my name is Dr. Jones. We're chatting about weight loss stalls. We're chatting about solutions to slow weight loss, minimizing side effects. Hello, Alexa. Minimizing complications, maximizing results. I'm going to teach you guys the secret to achieving lasting weight loss on these medications. Weightlifting is definitely one important trick. One important tool that we have is weight training without a doubt. Making sure that you guys are safe, making sure that there's no complications. Hello, Faye, watching on YouTube. Yes, uh, keto for anti-inflammatory benefits. I'm a big fan of keto. I'm a big fan of carnivore. I'm a big fan of fasting. These tools are very, very powerful when used correctly. What's an affordable way to get access to GLP-1s if insurance won't cover them? You get them from us. Hey, Jennings, you get them from us because not only do we have the access to the more affordable compounded options, A. Jennings, but we also have coaching. So what separates us is you'll get the coaching, the guidance, the structure, the support. We're going to set you up for long-term success is what we want for you and what we're striving for. You're welcome, Faye. And A. Jennings, you can reach out to us by texting the number on my shirt, or you can go to lastingweightlossnow.com. Either way. Is Magovi Steiner then meant? I don't understand your question, Virginia. Is Wegovy stronger? Is that what you're asking? What dose of Wegovy? There's a lot of information missing on your message there, so it's rather challenging for me to guess what you're saying. How much longer will compounding last? Guys, even if we lose access to tirzepatide in the next month, which is likely gonna happen, compounded access to tirzepatide, we still have semaglutide, we still have retatrutide, we still have cagrilintide, we still have a lot of different options for you. Remember, guys, at the end of the day, I don't care what tide, what GLP-1, it doesn't matter. What matters is lifestyle intervention. What matters is flow. What matters is you getting real serious about this, getting real serious about hitting these goals. That's what matters more so than anything else. Chrissy, we can get semaglutide as low as like 100 and low ends of 100 a month. We got yeah, we have low and that'll come with access to the community. That'll come with access to everything. Can semaglutide affect my bone density? Semaglutide can affect your bone density like semaglutide can create muscle mass loss. Yeah, if you take the medications and you don't eat your protein and you're not lifting weights, you can lose muscle mass and you can lose bone density mineral content. But that's not the medication's fault. That's your fault for not eating enough protein and not lifting heavy weights. I've been very serious about this for the last 6 months, and I'm not getting the weight loss I should be. Stargazer, I think it's time to reach out to us. I think it's time to shoot us a text message. Get yourself scheduled for that free consultation. We will do some comprehensive blood work. We're going to look at insulin resistance. We're going to look at inflammation. We're going to look at um, your thyroid function. We're the only place that's going to parse all these different pieces of the equation together, isolate what the problem is, and then work with you to fix it. So we'll smash the barriers, and then we're thinking with long-term lasting weight loss too as well. So we're going to make sure that you're set up for success long term. Does collagen protein in the coffee count as breakfast? Uh, if you're not long fasting, then yes. If you are not long fasting, then yes, you're gonna ruin your intermittent fast. But if you're already doing a flow fast 1 time per week, good morning tea. I'm not so stressed about collagen and your protein in the other days. but technically that does break your fast, yes. In an effort to be prepared for the current cost of retatrutide, a couple $100 a month user, depends how much you wanna buy. There's a 60 milligram bottle and a 32 milligram bottle. Were you thinking about getting other peptides with your retatrutide or other do you wanna get coaching? Do you want us to do labs? What are you looking to accomplish? Yeah, user, if you're looking to get all of the above, I would just shoot us a message here and go ahead and get yourself scheduled for that consultation. Um, Currently on tirzepatide and some Morlin. Yeah, we can help you, man. We got you covered. We're gonna make sure that you're kicking ass. The affiliate training program is to help you guys become successful affiliates, making sure that you guys are have the resources and have everything that you need. I think speaking of that, that's what I wanna do here. Um, what does Semorlin do? So Semorlin is a growth hormone secreting peptide. That's what, Semorlin does, and we use it to protect muscle mass, we use it to improve fat mobilization, the burning of fat in combo with GLP-1s. And a weight loss stall on carnivore is no different than any other weight loss stall. It's not different because you're on carnivore. You're probably not getting enough calories. I don't know. I'd have to work with you. I'd have to get into some deep consultations with you and figure out what's going on. Chrissy, how do we compare to Ibum, Mochi, and Amble and all these other places? Very simple. All they care about is just giving you the lowest price, getting you on the medications, and sending you on your way. But if you actually want coaching, guidance, structure, you want to be part of a community with thousands of individuals where we do challenges, where we support each other, or the future in my community is long-term weight maintenance, not just keeping you on larger doses of medications for the rest of your life and you guys are just kind of winging it. That's the big difference here. And so if you want to be part of something great, guys, then it all starts with a single text message to my team. Get scheduled for that free consultation and let's get some Yeah, you guys can join our coaching program even if you're in the UK. If you're not in the US, we can't prescribe to you. We can't, um, ship the medication to you, but you can still join our coaching program. Guys, I'm gonna hop off a little bit earlier. Jennings, I'm glad that you're gonna reach out to us. Good morning, Paulina. Good morning, Miro Ciari. I did see you guys messaging me on Instagram. That's awesome. Have you used 5-amino 1-MQ with any patients for weight loss? Yeah, 5-amino 1-MQ on its own is not good. It's not You're not gonna get much from 5-amino 1-MQ. AOD is going to be way you're way better off. We have 4 people, 3 people on Instagram. That's pretty cool. Guys, I'm gonna hop off a little bit earlier today. Since there was less people on, which is kind of interesting. I will go ahead and uh, end today's live. Any last minute questions? I got plenty of work. There's so much work I got to do, anyways. Um, any questions I can answer for you guys? Anything that you're running into? Any things that I can help you out with? We have Zoom calls. We have the community, Zoom small intimate, the Zoom large group. We have the Flow hotline, which is SMS, and then we have the community-based chats and the email support. So there's many different avenues of how you can reach out to us for support. Make sure you're following me on TikTok, guys. Make sure you're following me on YouTube and the podcast. Turn on your notifications, subscribe. I do go live every morning, Monday through Friday at 5:30 a.m. Mountain Standard Time. And then sometimes I go live in the evening and other times too as well. And so this phone number here is the best number to reach out to my team. So go ahead and shoot us a text message, save this number, get scheduled for that free consultation, get into the community, and let's make sure that you guys are doing this good. Make sure you guys are doing this right. You guys have a great Tuesday. We'll see everybody later.